So we did get you working. We got you synced up, and these do last after the conference.
Okay.
They'll keep going long after that. So the app is going to work for you as long as you want to use it.
We started Heka Health really to focus on all this great new technology in digital health and how can we work with other folks within the healthcare ecosystem, bring them together, because healthcare is really complex. And we saw this idea of, and it's easier said than done, but how do we bring everybody together, align interests so that we can come together, and it makes it much more powerful. Our strength is the technology platform, very modular, really easy to customize. But the other piece is, how do we align interests of other players, the association, the biopharma teams that we work with, the healthcare providers, physicians, pharmacists, nurses. How do we work through it so that we are all trying to go to the end same objective, but we have a little different lens that we're looking at that. How do we bring them together and work together? Because then you can really make an impact. And that's what really we saw is like, there's just people doing it on their own, and we wanted to do it together with other folks, bring in their strengths. The folks at the American Diabetes Association, we just had done an event, met the folks from the American Thoracic Society and said, oh, you got to do this, and they had been thinking about this. And so they actually introduced us to them. The key for us is listening and saying, what are you trying to get? What's your objective? And we talked about getting, one is they wanted to get their 15,000 to 20,000 people that come to this conference engaged, have some fun, friendly competition, liven it up, because they are, they're going sitting down at a lot of different conferences, but in between, let's get some steps and walk the talk. But then they also have sponsors that come here that are in their exhibit hall that want to engage more deeply with the participants. And they have their banners up, etc., but they also want to engage on a more meaningful level. So this is where they immediately went to Teva, and Teva was excited. They're like, that's a great way for us to promote sort of the healthy living concept, get us engaged with them. People are stopping by their booth, asking questions, engaging with their staff there. So that's a great win for them. And again, we're the glue that puts it together. So it's our technology platform, and we try to make it as turnkey and easy for the participants, but also ATS and Teva, because they have a lot of other things. Just take that load off them. But it really is front and center, the ATS Walking Challenge supported by Teva, and being able to brand it like that, I think that makes folks really, again, we're aligned interests. We're putting their interests in front of it, and then in the end, that makes it, the participants excited, but it works really what makes us successful as well.
The participants have been excited about this opportunity, and we've seen great feedback and response from the participants that's come by the booth.
Anything that's going to encourage people to get out there, so I think it's a great product. And I think it's really great that they're participating in this to let people see what the product's like. And
it's very comfortable. You don't even notice you have it on. And
it's been a great opportunity to partner with them relative to the Walking Challenge and to help inspire participants to keep with the mission of the ATS, which is to help people breathe better.